Hello, I'm Kevin Fenton from Public Health England. We're here to talk today about the risk factors that can lead to dementia. In particular, the actions that people can take in midlife to follow a healthy lifestyle which may reduce their risk of suffering from dementia in later life. With me here today are Martin Knapp, Professor of Social Policy at the London School of Economics, Professor Paul Lincoln, Chief Executive Officer of the UK Health Forum, and Dr. Charles Alessi, Senior Advisor at Public Health England and Lead for Dementia. Now, Charles, let me begin with you. Can you remind us about the scale of dementia and its likely future growth in cases?
Kevin, the on-screen graphic shows how extensive this is. It's estimated that there are 850,000 adults in the UK who are currently living with dementia. And this is projected to rise to over 1 million by 2025. By 2050, there are likely to be over 2 million people with dementia. Dementia poses huge costs, both emotional and financial, to people and populations. The Alzheimer's Society has estimated that the annual cost of dementia, both to those who develop it, those who care for them, and the cost more widely to society, is about £26 billion. As a GP, I've seen the effects of dementia on patients and their carers every day. And through a long career, dementia was an oft-recurring presentation, and the effect on the patient and on their carers was considerable. And this is something we really have to fix. We have to make it better for these people. When you consider that an estimated 21 million people in England have a close friend or family member with the condition, dementia has the scope to affect everybody, directly or indirectly.
Good points, Charles. And it's reflected in recent research as well that dementia is the most feared condition for people over the age of 55, including cancer and diabetes. At the UK Health Forum, preventing dementia and promoting brain health is one of our concerns. And our primary goal is to prevent non-communicable diseases. But what we know is that dementia and non-communicable diseases share many of the same risk factors. So what we try to do as an organisation is adopt an integrated and holistic approach to the promotion of health and well-being.
Thank you both. Now, Martin, as a leading researcher in dementia and its socioeconomic impact, what can you tell us about dementia and the risk factors for developing this condition?
Okay, well, we have to remember that dementia is an umbrella term for a number of conditions. The most common of those will be Alzheimer's disease and vascular dementia, and in fact they often occur in combination, and that combination is quite important because what we do know is that the risk factors for vascular dementia are very similar to the risk factors for cardiovascular disease or stroke, and so if we can do something to improve the heart health, then we could also improve the brain health. So things like reducing smoking, improving diet, exercise, reducing blood pressure, those are things that improve both the heart and the brain. Now, we've seen some improvements actually in recent decades. The Cognitive Function and Aging Study, which is a very important research project been going for many decades, found that the prevalence of dementia among the over 65s was 8.3% in 1990, but it had fallen to 6.5% by 2010. So a significant reduction, which probably reflects these changing lifestyle factors. However, the number of people with dementia is going to increase over the coming decades just because of the big aging boom in the population.
So that's a really interesting point about the reducing prevalence of dementia, and really encouraging too. So, to summarize, leading a healthier lifestyle by, for example, stopping smoking, reducing alcohol consumption, and doing more exercise and eating a healthy, balanced diet will not only reduce your risk of a heart attack or a stroke, but might also help to reduce your risk of developing dementia. Now, Paul, you were a key player in the Blackfriars consensus development, and this was on brain health and dementia. Can you remind us about what it has to say, as well as what is the role of dementia prevention?
Indeed. The Blackfriars consensus statement came as a result of a special meeting held in Blackfriars in London. It brought together a community of interest of scientists, researchers, people from across the public health community, policymakers, charities and clinicians, neurologists, cardiologists and stroke specialists. And it looked at the growing evidence for the overlap between the risk factors for cardiovascular disease and dementia. And the consensus calls for the incorporation of dementia risk reduction into current approaches in terms of the prevention of other non-communicable diseases. And this is now reflected in the government's plans, its 2020 vision on dementia. It also calls for a clear communication about this emerging evidence on dementia risks, on the protective factors, and on preventive actions, not only for the public, health and social care professionals, but also for policymakers. And lastly, but not least, it called for further research because this area is of such great public health importance. And this was supported by over 60 national organisations and experts from across the fields of dementia and broader non-communicable diseases.
That's really, really good. So we've talked about the vascular risk factors that can play a part in some dementias, and these include smoking, alcohol, and a poor diet. Now, Charles, what are some of the so-called protective factors that can play a part in preventing the onset of dementia?
Well, increased physical activity is certainly one of those protective factors. And there's a whole range of positive cognitive stimuli, including simple things like doing crosswords or puzzles, or even reading. And we know that loneliness is a major problem for some people as they get older. So social engagement such as meeting friends and getting out and about is really quite important. In fact, the Local Government Association has recommended that councils should address loneliness as an outcome measure of council strategies. And then, of course, there are environmental factors.
Yes, I think environment is really important here because we know that there are differences across the country, differences in the risk of dementia by age group, by gender, but also by income group and where people live. And so what we need is a very wide set of investments to reduce that risk, investments in the health sector, in public health, in local government, in environmental protection and so on.
So bringing the protective factors and the environmental risk factors together, Paul, what does this all mean for priorities for public health?
This means that we need stronger collaboration in terms of work between clinicians, the public health community, researchers, policymakers and charities, better integration of policy and programmes, and increased public and professional awareness of the risk and protective factors across the whole of the life course. There's an infographic on your screens now that talks about the new NICE guidance, which looks at midlife approaches to delaying or preventing the onset of dementia, disability and frailty in later life. And what this shows is it recommends a major role for local government and suggests ways in which local government can reduce the risk of dementia. The NICE guideline calls for developing and enforcing comprehensive tobacco controls, guidance and policies to reduce alcohol consumption, building living and working environments that encourage and enable people to increase their physical activity and recreational activities, such as, for example, active travel, for walking and cycling, and supporting healthy eating. It also talks about increased collaboration between local government and clinical commissioning groups to make this happen through the standard mechanisms with a focus on dementia and non-communicable diseases such as the Joint Strategic Needs Assessment, the working through the Local Health and Wellbeing Board and developing an appropriate health and wellbeing strategy to reflect these elements. But there are lots of other opportunities as well, such as, for example, the uptake of the NHS Health Checks. And perhaps, Charles, you might want to say a few words on this.
Yes, thank you. The NHS Health Check, which is for adults in England aged from 40 to 74, is a great opportunity for GPs and other health professionals to check a person's circulatory and vascular health. And what it does is it works out a person's risk of developing heart disease, stroke, type 2 diabetes and kidney disease. The check also includes a dementia element for those people attending who are aged 65 to 74. And Public Health England is about to pilot an approach to highlight dementia awareness in the 40 to 65-year-olds. There are very good examples where local authorities have worked with CCGs to drive uptake of the NHS Health Check in their area, and these are reported in this edition of Health Matters.
Great, so thank you all. We've heard how evidence is growing that modifying the risk factors for cardiovascular disease should also have a beneficial effect in reducing the prevalence of dementia in later life. We have heard how protective factors can also play a part in preventing the onset of dementia. And we've also heard how removing inequalities in education and the environment should also reduce the incidence of dementia. Do please take the time to explore this edition of Health Matters, which is aimed at supporting those of you who are involved in helping to promote health and well-being and to reduce the risk and prevalence of dementia. The resources include links to a variety of practical tools, case studies, and blogs. Thank you for watching.